Hi everybody. It's Tuesday the 27th. It's a week after my surgery. I said I would make a video today because I had my first follow-up appointment with my oral surgeon this morning at 9 o'clock. It went really well. I mean, I told him I was happy. Everything's going great. He thought that my swelling was doing pretty good. I was like, you should have saw me on day 3 because it wasn't good. But he's like, no, it looks really great. He said, I told him that I really didn't have any problems. Just, my lip and my chin are numb. My lower gums are numb. It's uncomfortable. It's, just uncomfortable, I guess. It's just a weird sensation. I'm unfortunately, slowly getting used to it. But pain-wise, I really didn't have that much. I mean, I have little sharp pains every once in a while, muscle spasms every once in a while. Sometimes I get like an earache kind of pain. But honestly, it's been, I feel like, a really smooth week compared to some of the things that I've read or seen on the internet people have gone through. I mean, I only had half the surgery. I didn't have an upper jaw surgery, so I definitely don't have to go through as much as some people do. Let's think. I got there. My surgeon came in. He had a student with him, a pre-dentistry student in there to observe. They took another 3D X-ray. They took a 3D X-ray on my pre-op appointment. Like, it was 11 days before my surgery. They took some, like, my physical and all that stuff. I took another 3D X-ray today. I haven't seen any of that stuff. I kind of saw some of it up on the screen, like, during my first appointment, but I haven't really looked at them. So he asked me how I was doing. He checked to make sure my bite was going where he wanted it to go, and it was. So he took my rubber bands off, and he's like, you don't need them anymore because the only reason that they're there is to, like, guide your bite. Like, I'm not going to move your teeth anymore. He's like, that's your orthodontist's job. It's not mine, so I'm not going to move your teeth. That's great. I told him that, I've been able to open my mouth wide enough to put a spoon in there, like a little baby spoon. So I've been, like, eating things that weren't necessarily clear liquids, and he's like, that's totally okay. Like, he doesn't care what my diet is, other than the fact that I can't chew anything. He's like, you can blend up or eat whatever you want as long as you're not chewing it. So that's good, because I was eating oatmeal, and stuff, and, like, some mashed potatoes at Christmas, and just whatever, chunky stuff. So I can continue that, and my only other restriction was still with I can't lift anything over 30 pounds, and moderate activity. It's kind of cold outside, so when I go from my car to, like, inside, I want to, like, run, but I'm like, I forget that I, like, really shouldn't, so I kind of, like, just walk really fast and, like, clench my teeth together so I don't rattle my teeth around. He checked my incision sites. He took my stitches out, so I have, they're right there and right there. This one's not as nice. Honestly, this side's not as nice, and I mean, they're both healing pretty good, but, like, this incision is, like, so much cleaner and, like, straight and nice, but that's okay. They're gonna both, it'll be fine. My internal stitches along the gums in here he said they should dissolve around another week or so. So that's good. They don't really bother me. The only thing is I can't, it's just I have to be careful when I brush my lower teeth, so I don't want to bump them. I guess what I'm just waiting for is the swelling to go down. I don't know. I'm less swollen on this side than I am on this side. Under the chin swelling is going away a little. It's still there. I'm starting to get some of the definition back in my cheek here, but I'm pretty swollen along the jawline, around the stitches area, pretty much. This side I'm a lot more swollen. I have, like, this whole area right here, and it's kind of hard, and, like, he told me I should start massaging the fibrous tissue areas to kind of break it up, because this side's definitely there's, like, a lump right here that I can, like, almost grab. So that's the only thing. I mean, I don't think that if people saw me and didn't know that I had surgery, I don't think that they would think anything's different. Which kind of sucks because I think it's still pretty different. But everyone's like, "Oh no, it looks better. You're almost back to normal." I'm like, "Oh my god, I don't want to be back to normal yet. I'm not happy. If this ends up being my normal, I am not that happy with it. No. Anyway, but I think I've got a ways to go. It's only been a week. There's no way that I'm close to having my swelling be gone. I'm getting used to, the rearrangement of my mouth. I feel like I already had a big tongue, and now I just feel like it's even bigger because it's like there's less room for it to move around in. My lips are in different spots. It's just weird. I love it, but it's just really, it's just weird. He said my midline, they're right on, but I'm still, I still see that. Look, it goes down. I have more space over here. I do have an open bite on the side. He says that one of my teeth is hitting early. I don't know if it's my lateral or my canine. It looks like it's my lateral that's hitting early, but that's all stuff that my orthodontist will, shift around. She'll close my bite. She'll make everything perfect. I don't know when I'll get to see her. He told me not to worry about it, that he would let me know when I could go see her. It'll probably be 6 weeks. So other than that, I guess I'm pretty happy. I'm really glad with the way things are going. Oh, today, my face did hurt. Like today, it's probably been the longest amount of time during the day that I've been in that kind of like discomfort. I think it was just the fact that I was opening my mouth wider and, stretching it and practicing. Like, I can only open this far. Before the surgery, I could fit at least 3 fingers in my mouth going like this. The reason I know that is because I'm in dental hygiene school, and a part of our intraoral, extraoral cancer screening, we have to ask people how many fingers they can fit in their mouth. So when we practice on each other, we all do it, and I know that I easily fit 3 fingers in my mouth. Now, I can't even get 2 in, so I got a ways to go, because I had a big old mouth before. I could open it really wide, and I liked it, and I hope I could do it again, because that's just how it is. I want that back. And my teeth they're not big teeth, but I think they look bigger now that they're like, the front teeth look bigger now that they're where they're supposed to be. Before, they were like just competing with my lower teeth, and they just seemed like little tiny baby teeth, and now they actually look like, decent sized teeth. I still have that, it's just kind of weird when I have all my teeth are like the same length from canine to canine. It's kind of funny. But okay, so yeah, like I said, only restrictions are food, no chewing for 3 more weeks, which is going to be torture because all I can think about is eating and biting into things, and I cannot wait. Because technically I have 5 weeks before I probably will be able to like bite into like a sandwich or something, or I don't know. So that, and just the weight lifting things, I've only lost like 7 pounds, which is fine. I don't have a problem losing or not losing. Obviously I wouldn't have wanted to gain from having this surgery, but especially because I've been able to like eat a little bit more, I haven't been completely clear liquids. I didn't expect to lose a ton of weight. It's okay though. The only thing is I want to try to keep whatever I can lose. I want to try to keep off afterwards. So, I guess the more the merrier. I don't feel sickly. I don't feel weak. I don't feel anything. So, the weight part hasn't affected me. And I don't know, I guess I go back to see my surgeon in 2 weeks, and it'll probably just be a quick checkup. I don't know what I start school the day after, and then a week into school I'll be officially a month recovered. Can't wait till that day. It'll be great. But I don't know when I'll update this unless something changes. If I have pain, if something shifts, if my swelling goes down, then I'll update. But other than that, I'm not doing anything. Nothing's changed. I'm still doing my mouth rinses, my warm saline rinses, brushing my teeth, 3 or 4 times a day. I only have like a day left of antibiotics. I took some Motrin today because of, the pain in my face. I just needed something to distract me. I couldn't think of anything other than the fact that my face hurt. I'm lying down in bed again on my back, not really laying on my stomach, and that's usually how I sleep, but I don't want to do that yet. So yeah, things are good, and I'm really happy so far. So if you're having surgery, I tell you do it, because it's not the worst thing ever. Yeah, at least nothing bad's happened to me, so I can say that. All right, well, thanks, and I'll try to make a video, whenever something significant happens. Bye.